and it's okay. And I have worked in the healthcare industry for as a job for more than 13 years. I've worked with Reliance Healthcare in pharmaceutical companies, and I have got a lot of diversified experience because of my working profession. Previously, homeopathy was not that much recognized, but thanks to my mentor, Dr. Geeta Punjabi, in the year 2008-2009, she went on to teach me advanced homeopathy, after which I did my master's from West Bengal University. I got my certifications also from West Bengal universities. I got my practicing certificate. And we sort of had a team of doctors whom she used to mentor under her. And we prepared a lot of notes and got a lot of exposure and a lot of experiences. And because of my diversified experience, because of her mentorship, because of the views of all the other doctors, we were successful in preparing a pattern of diseases which used to emerge, and notes for, say, for example, for diabetes, for psoriasis, for blood pressure. Then the new remedies which were causing adverse drug reactions was my experience, which I brought into my practice. And through that counseling and we prepared a sort of approach as to how we should consult people, how we should be taking the case taking, how we should repertorize to find out the remedies, how we can prepare the group of remedies, which was the best mentorship she gave me. Previously, I was very scared to actually mix remedies, but she showed me in Hahnemann Organon 8th edition in 1853, where he had written that you can mix as many remedies as indicated by the disease. After that, I started mixing remedies, and the healing what I found was, the results were amazing. I mean, it proved that homeopathy actually cures miraculously. So with that experience, and now due to this pandemic, I got an opportunity from my society, my friends, my colleagues, to start up a homeopathic pharmacy. I had been dreaming of this since last 5-6 years, but I had less hope that, I will end up in actually opening up a pharmacy, which actually happened because of the pandemic. Last year, I opened up this Amazo Health Pharmacy. So I'll give some introduction in the presentation about that also. Do not take it personally that I'm promoting my brand or something, but yes, it's my baby, which I need to nurture and which I need to bring forward what exactly we do into that. And then we'll talk about the topics, about what homeopathy is and what we have decided on the topics today. The principles of homeopathy, basically, how it gives an advanced miraculous cure. Right, so I'll share my screen over here.
Excuse me, I'm getting a breakup in voice. Is it only for me or?
Only for you. Manuela, it's clear for us.
Hello?
Manuela, it is all clear for us. It's only for you.
1 second. I can start recording now.
Yeah, you can.
Okay.
And how do I do that?
There will be an option now that will ask you to down at the bottom. No, there is share screen. No? Next to that is record.
1 second, I'm stopping sharing. Okay. So everybody can see the screen now?
Yes. Yes.
Okay. So today's topic is principles of homeopathy and advanced miraculous healer. As I introduce myself, I'm the director for Amazo Health. That's a homeopathic pharmacy. We also give nutraceutical supplements and cosmetic skincare products. This was founded in December 2021 in Mumbai. This was a dream project of mine. And just introduce.
Some issue, I think. Okay.
Yeah, so I'll just give an introduction about myself and Amazo Health. This was the opening up a homeopathic pharmacy was a dream project of mine. Previously, it was run as Fast Track India since 2004. That gave a breakthrough to heal and cure all acute and chronic illnesses, and also breaking the myth that homeopathy acts very slow. So it began by shared experiences of students of Dr. Geeta Punjabi, who was an ex-examiner and lecturer at a homeopathic college in Irla, Mumbai, Maharashtra, India. And we believe that in the today's world of changing, the complex lifestyle brings with it complex diseases. So previously, homeopathy, we used to practice classical homeopathy. After that, we learned that complex lifestyle, we have to prepare a complex customized group of remedies. And the choice is definitely we have to select remedies as per the classical homeopathy. But then as we started preparing this group, each disease would emerge as a pattern. For example, if we are treating a case of diabetes and we prepare a group of remedies and give it to that patient for him to treat diabetes, after a certain time, again, another patient with diabetes, the same remedies are selected. That prompted us to prepare a combination of homeopathic medicines to give excellent results. Now, the use and provings of these homeopathic formulations that Amazo Health has prepared, its team has prepared, will help all the new emerging homeopaths and the alternative healers to practice more safely and confidently, because they'll be assured of the results. These are all proven technologies, proven remedies, and selected promptly through the given cases or given the indications of the diseases. So when we started in Mumbai, a lot of people have supported, a lot of experts who have put in meticulous efforts to produce these medicines. And in this, we have, like, for example, Auto Treat, which is a homeopathic medicines for otitis externa media, like ear pain. A lot of children get these pain. Braino Health, that is a homeopathic medicine which is given to children to increase their concentration. Gripo Relief, this is a homeopathic medicine for colic pain in newborn infants. And as all these medicines are prepared as per the approved standards of the pharma industry. And emphasis is also laid on the cleanliness and germ-free manufacturing of these medicines. We have pill filling machines where we don't touch with the hand to the medicines. We prepare batches of medicines which are lab tested, and only after the results they are prepared in small dilutions or small pill form bottles and laid out in the market. Utmost care is taken for contamination-free production techniques, and even the plant has a separate quality assurance lab where every batches are tested and strictly evaluated for their pharmacopoeial requirements. So all our standards are set according to the homeopathic pharmacopoeia of India. And the best homeopathic pharmacopoeia of UK is actually the German people, because homeopathy was started from Germany. So when we have to export certain things, we do take the remedies which are already there since Hahnemann time, and we do not go in for new remedies because that is more than enough. Along with the biochem tissue remedies gives us the results what we require. Unless the complex lifestyle, there is some new disease emerging and some new remedies are coming up in the market. Otherwise, we stick to the standard protocols. So what are our skills and expertise? Right from starting from, you can say before 2000, we have had more than 100 patents in this multiple therapeutic areas. Like, for example, we have heart smart patents are there. We have skincare patents. We have special children patents. And we have general category homeopathic patents also. We have more than 1 lakh satisfied clients. All these medicines are hand formulated, exact combinations, and with strictly quality measures to manufacture them. And the strength of our these formulations basically is the diagnosis. The diagnosis has to be perfect to give a particular brand or a particular remedy. They are categorized, so you can go according to the categories also to search for a already formulated medicine. And the pricing are such that each and every Indian can afford. As it is, homeopathy is cheap, and the pricing also we have kept it more lower so that everybody can afford it, because our main intent is to reach millions. Now, in the beginning only, I will start with some case studies. Why? Because you need to know that how miraculous and how beautiful we have got results. I'll not take much case studies. For that, we can take another session. Right now, I'm just taking 3 case studies. One is of a male, one is of a female, and one is of a special child. So she's Agnes De Cruz, and on the right hand side, what is given is what she has actually texted me on WhatsApp. It's her own statements. Initially, when she presented to me, she presented with non-insulin dependent diabetes. She had high cholesterol. When I took her blood pressure, it was drastically high, maybe around some 180, 200 to 120, 140. That was that high. She was very much energy depleted, and she had just begun her menopause, which she had again, due to that also she was feeling very low in her energy. She had a tongue coating which was black discoloration, and when I asked her, she said it has been since many years, which she doesn't even remember. She had squinted eyes, which we take into consideration for homeopathic treatments. And there was a lot of irritability because her husband was in Dubai and she was not able to cope up alone here of her family responsibilities. And because of the stress, she was not able to sleep well. Her HbA1c was almost more than 10 that time when she came to me. And she has been through the thick and thin of her life, almost around 8 to 10 years with me. And now I can say that, yes, within a year, her cholesterol and hypertension had reversed. And now after 8 to 10 years, her HbA1c remains at 6 and below 6, which is a very good control. And so we can say that, yes, her diabetes is also completely reversed now. Reversing diabetes was a little tough for me. I should accept that, because her husband was not here. Once her husband came here, he changed the lifestyle very strictly, and then just within 3 months we were successful. So she tells me here that, hi doctor, the homeopathic treatment has been very beneficial for me. My health has improved quite a bit, and I've been very happy throughout the treatment. Always appreciated the fact that along with being my doctor, you have treated me like a friend. Thank you. That means the patient confidentiality was always there. I used to put myself in the patient's shoes. I used to understand what her feelings were. And I exactly knew what I had to do at the first stroke, what I had to take the rubrics, how to select the remedies. And because she had insomnia and those things had to be, if she would not able to eat anything, her tongue would burn. So if that would stop, she would be very happy that now my tongue is not burning and I'm able to eat. So those were the small signs which made her more confident to continue the treatment. And then I gave her hope that, yes, diabetes can be reversed, and then we worked towards it. So that's how we actually became friends. You can say that. He is Mr. Selvim, and he is a patient which I got from Dr. Geeta Punjabi. He used to come to the charitable unit first, and after she retired, she gave on the case to me. He is he's had some heart problems for which he was hospitalized, and this is all after patient consent. I'm giving it. I'm not just saying the facts without the patient consent. So he actually, when he was hospitalized, he was transfused some blood and he came home with AIDS, which was a very bad news for him because he had to take it now lifelong with that. And so he was very hesitant to re-hospitalize him even when he suffered COVID. He had high fever, he had cough, and when he went for HRCT and chest X-ray, he was detected with pneumonia. So he said, I want to get only homeopathic treatment and nothing else. Although I used to send him for the reports, and sometimes he used to go to his GP for some advice or for some moral support, because he had been treating him since long. And while the treatment was there, you can see on the picture, there is a picture of his X-ray over there. There are his reports down. And while his treatment was going, he started having eruptions on the skin, on his back, and with a lot of itching and irritability, which got resolved. And there was only some, the right side, which is showing some round scars. These are the black scars, which were after healing, they were left, and which were also resolved after some time. So he not only recovered from the viral pneumonia, which was detected but during COVID, but he also gained weight, because in AIDS, he was always low on his immunity, and he had lost around 5 to 6 kgs of weight, which there was no hope, seeing his age and his condition, that he will gain weight. But yes, he gained weight and he was very happy. And he sent me pictures of his hair growth. I think I have removed those pictures, are not there now, but he had regrowth of his hair on his scalp. So it was like he was regenerated so well, and he was extremely satisfied with the treatment. He's also a good human being, and because of his satisfaction, he keeps on referring a lot of patients to me. So when I asked him to send some review, he sent me this message, what is there, you can read on the screen. He had a very good experience with homeopathic treatment. We are undergoing these medicines for many years, and it's giving really a wonderful treatment. Because his wife is also my patient, she's also taking, and even his daughter has taken medicines, and a lot of his relatives, his mother and other relatives, are also taken. And yes, with your guidance, we had overcome lots of health issues with ease and in very short time period. So again, your very short time period, because his cough, his pneumonia had resolved miraculously in a very short time period. Your wonderful advice and confidence, talking cures us a lot. Advice I would give them for the eating habits, for resting, for there's a healthy milk lelo. These type of advices were given to him, and which would motivate them. Sometimes what happens when we are sick, we don't remember kya karna chahiye, kya khana chahiye. So small tips would help them a lot. And thanks for this great help, doctor. Also, we shall prefer these medicines and treatment under your prescription to many having issues with their health. So he again came back to me also after I started Amazo Health, the homeopathic pharmacy. And I used to give him the combinations what we had prepared from a pharmacy. And he got the same results what we used to give them, prepare medicines and give them. So he was very happy with that also, that he can refer this customized group of remedies also to his friends and relatives. This one is a special child. We don't like, these are the children from the Garkul school, which they had around 35 students, and I had been almost taking cases of each and every student. So basically it was just to, give a human support and a moral support to the parents also to, continue their life, which they had to struggle through. So he was a patient, Atharva. He suffered cerebral palsy and he had convulsions because of the ignorance of the nurses when they were delivering, because of the forceps delivery. His brain was actually damaged at that time, and because of which he suffered convulsions, and now he has to bear with the cerebral palsy lifelong. So because of the stroke that time, his growth and development had arrested. And when he came to me, he presented to me, I was really scared, I can say. And because he was not even able to hold his neck, and seeing his age, he was very tiny compared to his age. He was around 12 years, but he used to look like 4, 5, 6 years. And there was a lot of growth and development delay. But yes, thanks to the Garkul school, they also helped him a lot for his growth and development. But we started with homeopathic medicines, and this is the chat what I have put over here. These are his prescriptions, what the doctor had recommended from a government hospital for his cerebral palsy. that they have to take this lifelong. And when I saw his MRI brain reports, there was a scar in his brain. And I somehow tried to convince her that we have to tackle the scar first, so that there has to be regeneration and regeneration of cells happening in his brain. Only then his growth and development will start. So we had to stop certain medicines which I have recommended to her over here. I asked her to continue with the vitamins and syrup for convulsion, which was safe and as a preventive measure. But rest, everything was replaced with homeopathic medicines. And especially I discontinued Bexol and Revicon, because that was given only to people who had Parkinson's and also 18 years of age and above. So I told her this is not advisable, and moreover, it had a lot of side effects which would delay the recovery of with homeopathic treatment. So you can see here, he is now holding his head very well, and he's participated in his school in some drawing, and he has done some coloring, and he's very happy. The below picture is of another girl, Samruddhi. She is no more with us, and I thought of sharing her also. She was a very cute girl, and I like to treat her, but unfortunately she's not with us now. And the one in the mobile is Atharva with his mother. His mother is also insulin-dependent diabetes patient. So let's come to our topic today, principles of homeopathy. As you all must be knowing, homeopathy now is well known. I don't need to tell you all these things, but yet we will discuss this. Homeopathy is a field of alternative medicine introduced by Samuel Hahnemann in 1976. It works on the principle similarity of symptoms. Substance causing symptoms of disease in healthy individual will show the same symptoms in the sick. So Hahnemann used to try the medicines himself, and it is said that when he tried lachesis, which is a snake remedy, he was not able to wear his collared shirt all his life, because it's a throat medicine and it is a snake remedy. So he took it in the crude form. That is why it happened. Homeopathic medicines are not given in the crude forms. They are potentized and given in a milder form, which the body can absorb easily and accept easily. Homeopathic medicine include treatment using natural sources such as plants, animals, and chemicals or minerals. It involves administration of small doses having specific composition. It's also known to be originated in Europe. It's brought up in US and progressed in India, because India is a disease capital, as you know, for many diseases like diabetes, chronic kidney disease, and cancer. So the progression of anything which is invented outside, discovered outside in the globally also again ends up in India, because for internships, people from abroad are sent to India, because India is a disease capital and you find each and every disease in India. There are a lot of segments in homeopathy, and this is just a segment which I'm showing over here. The end users, as for the end users and the products, which is marketed in outside, but definitely there are very much another sub-segments, and the list is vast and very huge. So the segments include the reproductive disorders, hormonal imbalances, and lifestyle diseases, as far as the end users are accepting it, end users are demanding it. And as far as the products are concerned, they are basically segmented into plant-based, animal-based, and mineral-based. Homeopathy gives a holistic healing. How? Previously, it was like classical homeopathy. Yes, classical homeopathy still works. And in my family, in my house, still we practice classical homeopathy. But even the advanced homeopathy has been able to treat a lot of complex diseases, and have been able to correct a lot of wrong or complex lifestyles, simplify them, basically we can say that. So it gives miraculous results, for which you, and how you can identify, how you have to have the approach to use this advanced homeopathy to give the miraculous results, is through checking out how the remedies are prepared, whether it is prepared with manual potentization, which is a long-standing tradition of manufacturing. So now a lot of technology has advanced, and people start machining, and this bottle filling and packaging, and everything has started in with the help of machines. But the manual potentization of shaking, vigorous shaking to prepare the homeopathic medicines is still preferred, because it gives the best results, and the best percentage of that element is included in the even 1 drop of that medicine. Another thing what we should have towards getting the best miraculous results is focusing on the root cause and coming to the perfect diagnosis and perfect interpretation. Like, for example, I had a patient who had first, the root cause was like she began with suppression due to, say, she had, I think, malaria or typhoid, high fever was there, has suppressed fever was there. She presented with diabetes, but she came to me for medicines for only vertigo. Now she had diabetes, she had thyroid, and she came to me for medicines for vertigo. But we have to treat the root cause. What cause? So we had to consider, take into consideration suppression, diabetes, when and what the symptoms started, and how she realized that she is suffering from diabetes. What were the reasons, what was causing vertigo? So when I went into deeper this, I realized, okay, I had to give her some acute remedies for vertigo, but along with that, I had to, I also found out that the thyroid medicines, what she was taking, was causing her vertigo. So she had to actually change her thyroid medicines, and then gradually she actually went on to take homeopathic medicines for even for thyroid and for diabetes, because her vertigo was resolved. So if you want to resolve vertigo, we just can't give a classical homeopathic medicine for vertigo, and because she will again and again, it will keep on recurring. So we have to actually have the perfect diagnosis and interpretation and perfect remedy, find out the root cause also. We have to keep it simple, but follow up closely. Simple in the sense that I did not tell her that I am giving you holistic medicines. I prepared a group of remedy where I included certain hormonal remedies also, and certain remedies for her suppression and for her diabetes. But I told her that I'm giving you only medicines for vertigo. And there were some SOS medicines given, which was like acute vertigo pill. So if the more simple we keep it, we give them a lot of medicines, they will get confused. Or we explain to them a lot of things, they'll get confused. You just tell them, you take this medicine, see the proving to yourselves, and then you decide. So unlike antibiotics will, supposing you are taking for mouth ulcer, antibiotics will dry up your mucosal linings. But if you are taking for homeopathic for same mouth ulcer, you will see that the ulcer disappears miraculously, but also keeps your lining of the mouth, mucus lining of the mouth moist. It doesn't dry it up. So when we ask for them to notice these small symptoms, they realize that yes, it's working. That is what they want. They want to see the provings and follow up closely, as in the very first consultation, they are indicated that whatever minute to minute symptoms you see changes, you have to come and report to us. We have to be available to them for all their queries and all their doubts and all their symptoms, which are otherwise they feel it's not necessary for us to tell in homeopathy. Like, for example, Agnes, she had black coating on the tongue. Now for her, what was important was her diabetes, was her toothache, which she was not able to get a dental treatment because of her high sugar levels. But these symptoms, we have to tell them that these are important symptoms. Although minute, we have to take into consideration those things, because we get to the perfect diagnosis, we get to the perfect selection of the remedies. It helps us. So we have to make you yourself have to now take the initiative, that in case of any small notices, what you find the differences after initiating the medicines, you have to follow up closely and get some knowledge about the medicines, homeopathic medicines, what you are taking. And also you have to keep a track on your feelings and your experiences with the medicines after you have initiated. So you have to take the initiative to follow up closely. So we are preparing these patents, advanced homeopathic patents. These are wonderful mixtures which quickly restore the sick to health. These mixtures are prepared with scientific understanding and sound know-how of multiple therapeutic areas using Hahnemann's techniques and biochemic tissue remedies, along with heart strengthening remedies and concentrated dilutions to provide optimum results. So here we have like we have patents prepared from, we have given them codes for you all to remember the codes easily. There are certain nutritions, and for example, somebody is coming with acne. Along with we have acne clean medicine for that, which is a customized group of remedies for acne. Generally, it is a hot patient. A lot of heat is reflected from the skin itself. They are short of, I mean, the water they are drinking is not enough. They have bowel problems. They have constipation problems. And they also want to hunt for something which they can apply on the acne and get themselves clean. So we have, for the acne, we have certain face wash we give them ointments also. So it's a combination therapy. And we also ask them to drink more water, which they know. Actually, a lot of people go on the net and now find out how to, heal of acne, but it bothers them a lot. And this is just an example. So when we prepare this customized group of remedies, if we are preparing, say, for diabetes, we not only give the low sugar lowering medicines, but we also add to it heart strengthening remedies because it's a cardiovascular disease. And along with that, we add some biochemic tissue remedies, which replenishes their wear and tear of the tissues. So in the long run, everything in a combination is going to give them not only 100% result, but much more beyond that. And today you survive, you thrive only when you give something more than what the customer is expecting. So next we come to this knowing homeopathy to build on the silos. Now, a lot of time, patients or customers are confused whether they should, switch on to homeopathy completely for treatment, whether they should, what they should take for allopathy, whether they can completely wean off the allopathy. This is a common question or common difficulty among the customers. They are confused. So homeopathy also itself has a lot of clinical trials. You can go on the ICMR's site, and there are a lot of views and a lot of provings of homeopathy given on that site. And rather than confusing the patient, we should try to build on the silos that homeopathy, one has to understand that homeopathy works on the provings and not on the completely on the clinical research, as unlike the allopathic medicines. Allopathic medicines, they have the molecule in the chemical formula, and that has to be proven through clinical researches, and then it is launched in the market. But homeopathy, we have provings. So you have to trust, you have to have the faith. As it is, homeopathy is very safe. You don't have any side effects on that. Sometimes you do have aggravation, which when you stop, it disappears again, it reverses. So you have to have the trust, and when you get the results, those are recorded, those provings are recorded, and they are then published in the on the ICMR site. So these are the challenges like the patients and the physicians face. Then the allopathic physicians are confused. Oh, she's taking homeopathy, I don't know now what to do. But no, it's nothing like that. These can be taken with the conventional medicines also. I have given homeopathic medicines with steroids also. They will act a little slow because the steroid will dominate by the time they are releasing their molecule, their content. But yes, it definitely acts. So what should be done in such scenario? Such a scenario is that you gain little bit of knowledge, whatever your mind is confusing, whatever queries or doubts or questions you have, discuss it with, find it out properly from good resources. from reliable resources, get the knowledge of homeopathy, and all these problems will help to assist in effective management of chronic diseases. Especially these silos have to be built up because of the chronic diseases. Chronic diseases, certain diseases, patients get depressed that they are not able to reverse their disease and they have to live with it for lifelong, which bothers them, and that itself causes so much of stress to the patient. So we at Amazo Health are very open to collaborate with pioneer institutions or even doctors or even the laymen who, and because we intend to offer teachings and provings of homeopathy, biochemistry, and their comparative studies. So here we want all of us to work collectively towards your good health, towards healing each and every person who desires it. Supporting the high-risk patients. So what does this mean? Like a patient is having high-risk heart attack. So we have a category of heart smart patents prepared over here. We have remedies for heart attack. We have remedies for ischemic heart disease. We have remedies for myocardial infarction. We have remedies for valvular heart disease. So these patent wonderful mixtures for chief illnesses, like we take those chief illnesses along with the remedies. So like, for example, the valvular heart disease. Now, valve has an elasticity. So we add certain biochemic tissue remedies which will improve the elasticity of the tissues of the cells. We help the flow of the blood. We try to select remedies which will improve the flow of the blood in the correct direction. And along with that, because it's related to heart, we will give them some heart strengthening remedies so that they can withstand the course of the duration of the course of treatment. And we will give them remedies for, if you are treating, say, a brain problem like cerebral palsy or something, or a kidney stone, then we will support that organ. We will try to strengthen that organ so that overall the body is able to withstand the course of the treatment. We will also try to improve hormonal efficiencies. So these groups are prepared in such a way, the remedies are selected in such a way that they, some of the remedies will be to cure the illness, some of the remedies will be to support or strengthen that organ, some of the remedies will be to repair the tissues, some of the remedies will be to improve the hormonal function if it is a hormonal related disease. So each remedy is chosen with utmost care. Overall, in the long term, it should provide the good health and improve the life expectancy of that human being. Overall immunity is also boosted, and death ratio is also found to be miraculously reduced to 0 due to the faith and confidence homeopathy provides. Even World Health Organization has recognized homeopathy and declared homeopathy as the second best line of treatment medical system, which is used internationally. So it is not only in India, globally, homeopathy is declared as the best second line of treatment next to allopathy, because yes, you have emergencies and you have to give certain treatment in the time of crisis. And the government that time in 2005 had proposed that MBBS doctors, if given 1 year of training, they can, training of homeopathy can be given to them so that they also get the knowledge about what their treatment, what their patients are taking as a second line of treatment. They go on take alternative medicines. So when they're taking homeopathy, they would not understand. And they would not, if they know properly, they would not repeat those treatment cycles. So that time also government had proposed, and I know a lot of myself, I know a lot of MBBS doctors who have been giving homeopathic treatment along in their practice also. I know a lot of dermatologists also who are recommending homeopathic treatments to their patients. They are themselves dispensing in their clinic also. Next, we come to advantages of homeopathy. Now, the best advantage of homeopathy is that it's very economical. Unlike allopathic, the conventional treatments, they end up in lakhs and lakhs of expenses, and due to which the GDP of that country also falls, because India is a disease capital. The GDP of India is also falling because of the lot of conventional treatments which are given in the hospitals. So as far as if you can treat or cure something with homeopathy, need not rush to the hospital all the time. So homeopathic, because the homeopathic pills itself are very economical. They are like sugar pills. You must be knowing that it's lactose, and it's very affordable, and it cuts down the cost factor almost 70 to 80% of your, it's going from your pocket also, right? It's not always the insurance. So one must consider this. Homeopathy gives a holistic treatment. Like for example, if you are, say, you have diabetes, you have to go to a cardiologist. You have, again, that person if is suffering from thyroid disease has to go to an endocrinologist. And again, if that person is having, say, arthritis or having vertigo problems, they will then go to their GPs or their own doctors, and so on and so forth. But homeopathy, you don't have to run to different doctors. It treats you holistically. It treats your intellectual, it takes into consideration your emotions, your physical symptoms, and even also spirituality. Because once you start healing, once you start getting the hope that yes, I'll be better, my disease will be reversed and I'll be completely out of it, spiritually you will feel very happy. And that happy itself releases certain enzymes in your brain, which heals, which again cures yourself. So homeopathy gives a holistic treatment. Another advantage of homeopathy is all problems, one solution. As I said, you don't have to run to different specialties for different system disorders. You can get everything under one roof. Just that you have to have that patience that each and every problem will be tackled simultaneously. But the cure will happen in the reverse order. First, the vertigo will go, then the thyroid will disappear or reduce to normal, and then her diabetes will be reversed. So you have to have that patience that it will simultaneously cure. Homeopathy is painless. Lot of people fear going for surgeries and going to hospitals and taking chemotherapies and going under whatnot treatments, because they know that along with not only with the money, but they have to suffer a lot in these long-term treatments. So these conditions like kidney stone, gallbladder stones, fissures, tumors. Now some of these diseases also recur back. Supposing you have a kidney stone removal, it may recur back. Gallbladder, yes, they remove the gallbladder, so it won't recur, but then the liver will start getting infected. Fissures, they often happen on and off. So homeopathy, you have to be rest assured that it is a painless treatment. And because of that, even the kids have accepted it very well. And one should understand that the children loves it, yes, but we have treatment for the chronic illnesses also. And so if you have fear or if you have a disease which is, you know, that's going to recur, you should definitely go for this painless homeopathic treatment. So homeopathy overall gives you a better quality of life. Individuals under homeopathic treatment experience overall well-being. They feel very better emotionally, mentally, physically, spiritually. They develop good immunity because homeopathy, unlike antibiotics, builds up your immunity. It doesn't destroy your natural immunity. They tend to fall less sick over a period of time because their immunity is restored. And then therefore they can live a healthier and a fruitful life. You can work towards your life own progress. You can think about something else when you are disease-free or you are having a healthier life. Homeopathy is effective even in chronic diseases. In this scientific era of health consciousness, when the disease advances to an incurable stage and is not responding to any line of treatment, homeopathy can positively help 90% of these diseases we have today. However, if given timely and started at an early stage, it prevents disease advancement to an otherwise incurable disorder. Homeopathy is a near complete system of medicine and is not limited to certain illnesses, but is universally applicable to all kinds of diseases, whether it is acute or chronic. So if you keep on thinking, yes, after this, I will go and start homeopathy. Like a lot of people now in this pandemic also, I'm getting patients who suffered COVID. They are positive, COVID positive. They take allopathic course and then they come to us for homeopathy with the after symptoms of the COVID. So be assured that yes, we have treatment for COVID also. And it's a viral infection. You don't have, it's not a bacterial infection that needs antibiotic support. It's not that homeopathy cannot heal or cannot give fast results in COVID. Yes, you will have, these are all immunity-based diseases. And homeopathy works more wonderfully because it restores your natural immunity. Whatever immunity will be destroyed in the course of allopathic treatment, and then you will come to homeopathy, might as well start from the day one. Also, when supposing you are you are seeing symptoms of, say, some cough or some fever, mild fever, just little body ache starting developing, you start taking homeopathy immediately. It will not progress only towards a chronic case. It will not progress towards cough or pneumonia where you have to get hospitalized or take some antibiotics. So the sooner the better. Or sometimes you progress the disease to an incurable disorder. Like, for example, in cancer and in those stages where we are not able to, it's already in the 4th or 5th stage. Sometimes I used to get patients initially. The first cancer patient, I remember still what I had. He presented to me when his cancer recurred to him 3rd time. He already had the skin grafting done. He already had a lot of chemo cycles done. His hemoglobin had gone down to 4. And that is the time you present. It's too late to cure them. And then the family is expecting that I should cure it. I told them that we will not be able to cure it, but yes, we will be able to give them a good quality of the lifespan, what is remaining with him. But you cannot expect that we can cure the disease and we can heal that person completely. So the timely start of homeopathy matters a lot. But be assured that yes, it is effective also in chronic diseases, which a lot of people have a notion that it doesn't cure in. You only go for the acute problems. In emergencies also, life-threatening situations, more important, and the life support is more important. Mechanical aid to the vital organs and to function normally has to be the first priority line of treatment. The life support is primary requirement before any medication. Even when you go to the hospital, rush to the hospital in emergency, first what they will see is life support. Give them oxygen, give them IV, whatever is required. And then the medicines are started. Then the diagnosis is taken and what medicines are to be started is decided. So homeopathy can be effectively used to recover secondary to the life support. Once the life support is given, once the oxygen, if they are like highly hypoxic, they have to be given oxygen. But yes, we do have remedies for hypoxia also. So as a secondary line of treatment, if you start homeopathic medicines, you will wean off the oxygen very soon or you will recover very fast. So it can be effectively used for trauma, stroke, snake bite, sepsis. A lot of time fluid overload is not something which is good taken care of in the hospitals. Toxicity, anemia due to chemotherapy and much more. Like they will give you chemotherapy, they'll say, okay, when your hemoglobin is again back to normal, you come and take the second dose of chemotherapy or the next dose of chemotherapy. So homeopathy can that time be very helpful in terms of curing your anemia or removing the toxicity or the sepsis in your blood. You have to understand this. Fluid overload will cause a lot of swelling. So that swelling will subside with homeopathic remedies. We have good biochemical tissue remedies to replenish and disappear the fluid overload, the swelling caused due to the fluid overload. So that's it all about the session. We have our contact details here. Sorry. So we have our contact details over here. And anybody has any questions or any queries can WhatsApp me or even can ask me right now. our pharmacy is licensed, and we are located at Santa Cruz East, Mumbai, Maharashtra, India. And we promise you to keep your faith lifetime. Thank you very much for all your attention, everybody who has given good attention. And I hope I finished in time, Reynolds.
Okay, doctor, I have a query.
Yes, yes.
My name is John.
Yes, John, tell me.
Yeah, now my query is some 30, 40 years back, I started getting these fatty lumps between the skin and the muscle. That is lipoma.
Yes.
So I went to a doctor, homeopath.
Okay.
And then first I got a surgery done in Kambala Hill Hospital. And then they said it's benign, it's not malignant. And it could be cancerous when I turn old. So then I left it that way. So we came across a homeopathy doctor. She said, okay, we'll do this lipoma treatment. So it was about 2 years we are taking the medicine, 3 years. So we asked her, what is the problem? I mean, the lump is not reducing in size also, nor is it disappearing. So she said, it's a homeopathy is like you sit in a train from Churchgate to Virar. So now the train is going and you're at Grant Road. So I said, when will I reach Bombay Central then, or Dadar? It will take time.
Right.
So then I lost faith in that, honestly speaking. That was about 30 years back.
30 years back?
Yeah, and now I'm 66.
Okay, okay.
So nowadays what happens at certain points, like near the chest or something like that, I get a deep pinprick if I press it. So
what about the lumps? They are there or they have disappeared?
It's grown. Now there are growing, it's like multiply. So how do I treat this? That is what, if I can come to you personally and discuss.
Yeah, you can WhatsApp me on this number.
Yes,
and, yes, I have treated lumps. And had you got a good treatment initially, it would have been really good, so that it would not have increased now so much. Now seeing your age also, it's difficult, but still it is, we'll go through, because we'll have to get some investigations done as of cholesterol and all. But yes, lumps, they have disappeared, because when we were working at the charitable, one of my colleague himself had got these lumps. He was a doctor. I don't know if he's there or not now, but online I have sent him that. I don't know, but yes, he had got those lumps, and he specifically insisted that you treat these lumps. And I really worked very hard that time, because that time we were like, just preparing preparing complex group of remedies. And that was the first time I selected biochemic tissue remedies also. Which afterwards my mentor started knowing that, she knows more about biochemic tissue remedies, and it reversed just in I think in 3 months. In 1 to 3 months, 1 month itself, it had gone almost 80%. But it used to come and go, because this is also blocking the circulation and all, wherever the lipomas occur. It's sort of benign, but yes, it's sort of it's at the back of your mind all the time that yes. And now it has grown. So
and the point is, it can turn cancerous. That time in Kambala Hill Hospital, before my marriage, I got that surgery done. A cyst was taken, and then kind of.
Trust me, lipoma is a lipoma. वो चर्बी का होता है. It's like it's not a blood clot exactly. Yes, it is a tumor of certain tissues of the cells only of blood, and mixed with muscles and that fat. But it doesn't turn cancerous. ये जो डरा देते हैं ना, यही प्रॉब्लम होता है. कैंसर कब होता है, क्यों होता है ना, वो आपको समझना चाहिए. So I'll tell you the remedies what I had given for lipoma. If any homeopaths are interested in knowing, I had given him arnica, because I still remember it was my first case of biochemic tissue remedy. Arnica I had given, calendula, phosphorus I had given. I had selected phosphorus 1 mg because I wanted to improve the circulation. Because to dissolve, once the lipoma dissolves or shrinks in size, we have to see to it that it doesn't recur. And that can be done only when you keep the circulation all the time at its peak. And he had got an injury. Usko thoda sa maar laga tha, after which it started, and it was genetic problem. So after which it had started, so I had given him Arnica and Calendula. Then I selected Calcarea floor and Silicea. Calcarea floor was in 6 potency and Silicea in 30 potency.
Okay.
जिससे उसकी size एकदम shrink हो गई. बहुत अच्छा हुआ था उसको.
So I'll come personally, doctor, to your clinic, and we'll discuss this.
Sure.
Thank you so much. Very valuable information.
Yeah.
Thank you.
Anybody else?
I have a question.
Doctor, I have a question.
Sorry, can you hear me? It's echoing.
Yeah.
Okay. So I'm definitely a very
Johan, your name is right?
Yeah.
Yeah, Johan, tell me.
So had been a very ardent patron of homeopathy. Started off treatment due to my reflux. So, but I don't want to discuss any case here. That I will talk to you one-on-one.
Okay.
Couple of very general things. One is if you are in Santa Cruz, do you have some centers around Bombay, or you only operate out of
right now in the pandemic? We are only operating teleconsultations because we don't want risks about these. But yes, we are shortly, in just 1 or 2 months, we'll be having an opening here at a Santa Cruz branch.
Hold up. You mentioned about classical, and so I just wanted to understand a little more about how. So previously, when I used to be treated, there used to be these pills and a little of powder, right? The normal powder, which acts like a catalyst, which are the boosters. Then recently, the doctor that I'm, and she's been really, really helpful in treating a lot of basic, from common cold to refluxes to a lot of other things.
Wow.
But this is something that you mentioned, right? So she prescribes 2 bottles. Mm-hmm. So there is a mix of remedy. This is something that you mentioned, right? Mixing of remedy. And then, of course, a lot of emphasis on the booster powder, the powder. So what is these things? If you can explain us, what exactly are these?
So I'm just here. I will explain you what is the classical homeopathy and what is advanced homeopathy. So basically, you can simplify it like classical homeopathy is monopharmacy, just a single remedy, which when we take the case, taking the history and everything, we try to find out a similar element on earth which matches exactly your personality, your problems and everything. So one single element, that is called a monopharmacy treatment. Now that was very successful in the previous times when life was very simple. It wasn't this complex. Today, there is so much of complexities in terms of environment, food and everything. So as far as we understand, like for this still works in the complex lifestyle. Also, it works in cases of acute illnesses. For example, you got an injury, you apply arnica. Example, you got a mouth ulcer, you take Moxol, it will work. So these are only single remedies. Now, when a patient presents with suppressions, when a patient presents with जैसे उसको हुआ था कोविड हुआ, there is viral fever, there is pneumonia, there is hypoxia, there is associated heart problems are there are blockages. How can you just treat it with one single remedy? It will not work. And as a practicing homeopath, initially when we used to practice classical homeopathy also, I used to give my children and all, sometimes we would get confused whether we have to select this remedy or we have to add one more remedy. Then we even the doctors who are practicing classical homeopathy sometimes adds 1, 2 or 3 drugs in their medicine pills bottles what they prepare, so that ultimately the patient has to heal. It's not that and we can definitely add the same potency medicines. That is not a problem at all. And another side, what this advanced homeopathy is polypharmacy. Here we prepare a customized group of remedies, taking into consideration the suppressions, the chief complaints of the patients, the acute and the chronic illnesses, the temperament of the patients, what type of nature it is, like it's a hot patient, a cold patient, his genetic problems and his lifestyle. what is his lifestyle also. Like, he's a veg eater, heavy eater, non-veg eater. All these factors are taken into consideration. Uska swabhav kaisa hai. And according to that, like supposing that time when he's presenting to us, he's under much depression or he's extremely weak. So we prepare a customized group of remedies like that, and it is specialized for that particular person. Now, when we started attending similar type of persons, like diabetes, we found out, yes, everybody, jisko bhi diabetes hota hai na, they are very, by nature, by metaphysical state, they are very loving in nature, and they expect the same type of love what they are giving to others, but they don't accept it. They want that type of love, but they don't accept. When they are given love, they'll say, oh, iski koi zarurat nahi thi. So we try to understand. Then their sugar levels are high, and if they are like say 10 years se diabetes hai, they crave sugar because they have lot of energy depletion. फिर हम लोग जब भी CMEs में जाते थे hospitals में, तो there I learned that diabetes may you have to see that a patient is not losing sugar in his, I mean he doesn't have protein in his urine. Microalbuminuria के लिए हमको check करना है. A person more than 2 years of diabetes, we have to check for microalbuminuria. So a lot of time diabetic patients है ना urine check ही नहीं कराते. It's understood कि हाँ है. And we miss out on these small factors. So if I'm treating a diabetes patient, I will also see to it that he doesn't have proteinuria or he doesn't have energy depletion. तो heart strengthening remedies के साथ में उसका proteinuria को भी treat करेंगे पहले, and gradually वो तो 15 दिन महीने में resolve हो जाता है, and then we remove those medicines from the group. So what we have done here in Amazo Health is we have prepared one group for proteinuria, one group for diabetes, one group for insulin dependent diabetes, one group for non-insulin dependent diabetes. So likewise, we have a catalog itself. So whoever will be taking the treatment, we will definitely be sending them the catalog also, so that you know that, and it is categorized. So according to your other problems, you can see what categories, agar aapko kuch kisi ko help ki zarurat hai, they can find out. And if it is something out of the catalog, then they can always take the consultation, and we'll be upgrading. Every year we'll be coming up with some more new categorized remedies. Like for example, in this catalog, we have not introduced reproductive system ki koi bhi medicines abhi tak nahi hai. So gradually we will be coming up with that.
So what you think, doctor, is that these medicines are now manufactured by your facility itself, and you all don't use the normal ones which are imported from Germany or the ones which are available in India?
No, these medicines are prepared from the dilutions and all we are taking from.
Dilutions from there, okay.
From there.
Okay.
And if somebody is willing to take some imported medicines, we are along with that. If we are allowing conventional medicines, why not take some German medicines? But we counsel them that seeing their condition, it may not be enough for them to give them the complete cure. I should not point out, but there is one German brand, jiski diabetes ki medicines doesn't have certain rubrics which are required for, especially for Indian people. So, and moreover, we are adding heart strengthening remedies, biochemic tissue remedies. So it becomes a strength, and it has, because of the remedies what we are selecting, it has to give result. Because it includes all the constitutional remedies also, which are the basic ones.
Is it true that we should never mix homeopathy with Ayurvedic or Unani medicines? Is it true, or is it only all rumor?
Yeah, I would myself personally would say that yes, I would prefer if somebody doesn't mix too many medicines together. There are a lot of reasons to that. One being that a person will not know what is healing them.
What is effect, right?
Yeah.
Right.
Second thing is, a person should be, if you are ingesting something, you are taking something, or you are following a line of treatment, you should very, very well be alert about it and know what you are exactly taking treatment. You should know that how homeopathic medicines are prepared, You should, all our medicines on the labels, we have the composition given. You should know the composition. You should know how they are prepared, and you should know the quality of what is selected. Like for example, abhi Ayurvedic mein, Ayurveda is a very beautiful science. Let me tell you, all the sciences are good. And Ayurvedic is the most ancient in India. It's like almost 3,500 years old. और आयुर्वेद में जो लिखा गया था कि if you combine, say for example, X and A and B, and you give it for arthritis or joint pains, it gives you a lot of relief. वो वात पित्त और इसके ऊपर ही काम करता है. वात प्रवृत्ति होती है, पित्त प्रवृत्ति होती है. So these are all herbs which are taken, they are mixed and crushed and powder, and they are mixed with honey or something, and they are prepared and given accordingly as per indicated. तो वो जो वेद में लिखा है, that is perfectly 100 नहीं 300% correct है, और उससे वो heal होता भी है. But the thing is, diagnosis perfect है कि नहीं, first thing. Second, positive factor हमको पता चला है कि नहीं. वो herb जो है, वो जो लिया है, जड़ी बूटी ली है, वो कहाँ पे उगा है, उसकी क्वालिटी क्या है. और सबसे ज्यादा आयुर्वेदिक में जो which we should know about is, which I have also found out because I was I'm dealing also in nutraceutical company, which is also, you can say, a herbal or a Ayurvedic company. So that is why from their training I came to know कि the proportion matters a lot in Ayurveda. Like for example, if it is said that A of 30%, A का 30% ले लो, B का 70% ले लो, and it will heal. The measurement, it is not just like एक वाटी ये ले लिया, 2-3 वाटी ये ले लिया. No, it has to be measured in very, very sharply. In micro milligrams also it has to be measured. And the measurement has to be so perfect, then it will give that type of relief. Another thing is that अगर वो कहीं पे कीचड़ में उगा है या उसको सुखाया है, बाहर सुखाया है, आयुर्वेदिक मेडिसिन बहुत टाइम सुखाते हैं वो लोग, ड्राई करके, क्रश करके. There is a lot of pollution there. वो कौवा आके उसके ऊपर चरक के जाता है, ऐसे it's very unhygienic. So we have to take care of all those things. And Unani, I don't know, Unani का मुझे ज़्यादा experience नहीं है, honestly. But yes, I would myself prefer कि आप एक ही line of treatment को पकड़ के रखें, have faith and confidence in yourself. Try to find out and select a good doctor. That is also more important. Do not hesitate. अगर doctor change करना है, फटाक से change करो. Do not hesitate to change the doctor, because after all, you know yourself more better than anybody else in the world, even the doctors.
No, so, I think the very basic philosophy is that whenever I recommend people homeopathy, they always say, "नहीं यार, ये मुझे अभी करना है, ठीक." So that perception is that it will take 5-10 years to even understand, to get the basic effect. But I have seen it work like in hours. So I have that confidence.
We have seen, my mentor has told me that she has seen a cancer का इधर इतना बड़ा tumor just fall off, like, just in not less than a month. और मेरे साथ ऐसा हुआ है. I have had a patient who was suffering from epilepsy, and almost like 8-10 साल से उसको problem था. I had given her an SOS medicines and everything. Her treatment was going on well. I realized that because of hunger, she would get those attacks. So when I told her not to starve herself and all that, counseling ho gaya, and her BP would shoot up many a times. So one fine day, her daughter just called me up and saying, "Mummy ko hospital leke ja rahe, she's had another attack." I said, "Did you give her SOS?" She said, "Where? Yeah, SOS is there." She just took, and मैंने बोला कितने दूं, मैंने ऐसे ही दे दो, ढक्कन में निकाल के 10-20 पिल्स एक साथ में, no problem. उसको दिया, वापस मैंने बोला 10 मिनट में रिपीट करो. They didn't मतलब हॉस्पिटलाइज किया, करना ही नहीं पड़ा. She came back home. Same way, my mentor, उसको भी एक एक्सपीरियंस ऐसा हुआ था. One of her good friend only, she was suffering from 105-degree temperature. They just informed her that she is having so much of temperature and उसकी हालत बहुत खराब है. We are taking her to the hospital. She said, "I'm coming. I'm coming along with her to the hospital." She took medicines from her home. Fever का group हम लोग ने बना के ही रखा था. In the charitable, we had such a big bottle of fever group made. From 20 medicines, we had prepared that. So immediately लेके गए. She just gave her some drops in water and her fever subsided. मतलब by the time she reached hospital, it was almost down to 100. So she wasn't hospitalized again. So there have been a lot of miraculous experiences with us also. The list is unending, I can say. And it's a beautiful science. I would just say that find out a good doctor and trust yourself and be consistent with the treatment. You will definitely see results.
Look forward to catching up with you.
Yeah, thank you.
Renaud, thanks for setting this up. I think one of the sessions that I've been waiting for.
It was an opportunity Reynolds has given me. Thank you so much, Reynolds, for this grand opportunity, I can say.
Doctor, I have a query. Can I talk to you?
Yeah, who is it?
Yeah. See, I'm from
Your voice is breaking.
Yeah. Can you hear me now?
Yeah, I can hear.
Can you hear me now?
Yeah, but I can see you.
I am from Santa Cruz East.
Doctor, you'll have to stop sharing the screen now.
Oh, okay.
Yeah, you can hear me.
Another point है Reynolds, homeopathic कब बंद करना है? That is also very important.
Doctor, can you hear me now?
Yeah.
Yeah, I'm from Santa Cruz East itself. I just want to know whether there's any medicine for Parkinson's.
Yes.
Yeah?
Yes.
So can we stop allopathy and switch over? And is there a cure? Because they say in allopathy there's no cure, but they can only control it.
Yeah. Homeopathy also, we don't commit to cure of it, but yes, we can reverse it a lot. Almost 100% we can reverse it. Yeah. But we have to see the age and we have to see how long it has been prevailing and whether along with that there are any comorbid conditions are associated with it. We'll have to see that.
About 70 years and 3 years of Parkinson, 3 to 4 years of Parkinson.
Cool. You can come to me for consultation.
Yeah. Where exactly is your clinic?
Santa Cruz East only. You WhatsApp me. I'll share with you the details.
Okay. And another thing, doctor, my brother-in-law has skin itching. He's in 80s. Oh. Is there anything like that? Yeah, he is taking allopathy, of course, but nothing has helped him. So you think homeopathy could help him? He just keeps on itching his whole body, yeah? Not in any parts particularly. The whole body itches.
Mm-hmm. So have you ever tried to find out why is this itching? Is it because of the allopathic medicines he's taking? There's some side effects of those medicines.
Lots of doctors, and each doctor has their own way of giving medicines. So I was just thinking, will homeopathic help or what? Can we take a try?
Yeah, you can definitely try, but then you should the patient himself should have confidence in homeopathy, because many a times I find out that these are the side effects of allopathic medicines. So either we have to change them or you have to shift them towards some other alternatives. Then only that itching will go, because I keep on giving homeopathic medicines and he keeps on taking those allopathic medicines which is causing the itching. The process goes on and on. So somewhere we have to draw the line. I'll tell you an example of my own mother. She was diagnosed with CKD, chronic kidney disease, when she was visiting a cardiologist. She was in her 80s or about 75 years of age. She was seeing a cardiologist at Bombay Hospital. Now that cardiologist will go along with their routine examinations and investigations and whatever tests they are doing. And she had cardiomegaly and here and there small symptoms. There was no diabetes, no cholesterol, no major cardiovascular problems were there. Just that her heart was, she had cardiomegaly and heart was expanding. She was scared, and that is why, seeing her age and all, my family decided that we'll keep a cardiologist in loop so that, in case of emergency, he's always there. Now, when they went through the routine investigations, her creatinine was found to be very high at certain point of time. And fortunately, that time I had just visited a seminar by Dr. Umesh Khanna, who's a nephrologist in Kandivali. And he, in the seminar itself, in the CME, he explained how certain NSAIDs and ARBs cause the damage to the kidney and the creatinine increases. And then he said that certain patients have to be given kidney sparing medicines, and these NSAIDs and ARBs cannot be given to them, and blah, blah, blah. So then When I saw this creatinine high, I told my family to consult a nephrologist, and fortunately they went to Umesh Khanna only. And immediately on the first stroke only, he changed all the cardiovascular cardiologist, whatever medicines he had given. And for almost 3 months, she was taking medicine from me for a lot of bloating and swelling and heaviness, what she used to feel because of the high creatinine. So her swelling would go someday and again it would recur. Again it would go someday, again it would recur. So I was behind them that reports nikalo, so that we know what's going on. Why is it coming back again and again? And then we were able to find out. And one more thing, what I found out was that when the cardiologist saw himself that the creatinine is so high, they did not refer him to a nephrologist or did not even tell them that, okay, there is another problem cropping up in the body. So this is a very sad state. I'm not pointing out to any doctors or any, you yourself have to take care of yourself. It's as simple as that.
Yeah. Thank you, doctor. I'll see you.
Yeah, thank you.
Thank you.
Hello.
Yeah. Joyce.
Doctor, this is Judith.
One second.
Can you hear me?
Yeah, I'm trying to see where Judith is.
Her video must be. Judith, your video is
Yeah,
on.
I saw. Yeah, video is off. No problem. Yeah, Judy, tell me.
If you have anything for Alzheimer's?
Yes, we have Alzheimer's also.
You have anything for Alzheimer's, which can be taken? Okay. I think we'll need to consult you. I'll meet you then.
Sure.
Okay, thank you.
Now, thanks to UK, United Kingdom, London, mein Dr. Robin Murphy, he has come up with repertories which have diagnosis as per clinical, which have medicines rubrics indicated as per the clinical diagnosis. So this is something very beautiful. Even the allopathic doctors can take advantage of, and even the educated or who wants to know more about homeopathy can learn a great deal from that.
Okay.
So rest assured, yes, we have for Parkinson's, for Alzheimer's, everything we have solutions.
Doctor, you're putting your address on the group?
Sorry?
Will you be putting your address and time availability of yours in the group?
Yeah, you have to take appointments because chronic cases, definitely it goes on for at least 1.5 hours minimum. And I would prefer for the chronic cases at least to share the reports on WhatsApp beforehand, so that, I'm ready with my consultation.
Okay. Thank you, doctor.
Yeah, and if we are preparing customized group of remedies, again, an hour is spent preparing that. It's not easy because we have to select the rubrics very, very carefully.
But you are available all throughout the week?
I'm available basically for the teleconsultations. I take Monday to Saturday, 2 to 5.
Okay.
Today also, I don't know, I have a tie-up with a corporate also. So today also they keep calling me. Maybe I have some consultation, but they want to put some appointment.
Thank you, doctor.
Doctor, I have a query for my wife.
John,
Yeah.
जब ये आपका consultation लेंगे तभी ले लेंगे ना?
Sure. Rheumatoid arthritis, she's got that, and then she's simultaneously taking homeopathy as well as allopathy. And this has been continued for so many years. So we want to talk to you about that when we come there.
Yeah, sure. I'll guide you through that also.
Yeah, thank you.
Certain diseases, then you have to take on and off. Like abhi recently, I think yesterday or day before only, I got a patient having a congenital problem. Congenital problems may be spina bifida, ये सब भी मैंने treat किया है. So this girl, she's 18 months and she has a congenital problem of choledochal cyst, a cyst in the bile duct. Now the parents are concerned, allopathic doctors are behind them, surgery karo, surgery karo, surgery karo, but surgery se wo jata nahi, and 18 months ke bacche mein surgery karke, it's a congenital problem, na? It's not going to resolve. So I counsel them that you have to understand that maybe you will have, if you are taking homeopathy, you will have to take lifelong. So gradually, once her cyst disappears or cyst becomes very small, still she will have on and off ongoing problems of liver or gallbladder, bile ke problem rahege, nausea, vomiting rehti hai. She is never to be given heavy loaded starchy or fatty foods. ये सब तो ध्यान रखना ही है, and I'll give them the group of remedies what I'm giving them. But gradually, right now the group is very big to share with them. But gradually I can tell them कि अभी आप ये खाली ले लो, ये tonic ले लो, या chelidonium ले लो, या nuxworm ले लो. Because gradually even I will identify the baby a more better what type of personality that is. Her mother had issues when she was pregnant. So she was under the guilt that because of her behavior in the pregnancy, she was 3 months, she was depressed, and there were a lot of issues in the family. So because of that, is the child that way? Then I counsel her, no, it is nothing like that. Congenital problems to aise hi aate hain. It's a blueprint of your previous life. I don't know if anybody believes in afterlife or no.
Okay, thank you.
Yeah.
Yeah.
So,
Doctor, I have one question.
Yeah.
My son, he always gets sneezing in the morning as well as in the.
Yeah, he has wheezing in the morning.
Sneezing, like sneezing. In the morning, he gets sneezing, lot of continuous sneezing like that. Why is that so?
It's because of low immunity. You should give him B12 complex, and arsenic album 1M in homeopathy will heal him. जब ये sneezing करता है ना, उसको 5 pills दे दो. He'll stop sneezing immediately.
What did you say?
Arsenic album. Huh?
Please repeat.
Arsenic album 1M.
Arsenic.
Arsenic. ARSENIC.
ARSENIC. C. Okay.
ALB. That's another. Yeah.
So where will I get this medicine?
From our pharmacy. Where are you calling from? You can get from any homeopathic pharmacy, but where are you calling from?
I'm calling from Santa Cruz East only.
Yeah, so we will give you from our pharmacy.
Where is your pharmacy, ma'am?
I'll WhatsApp you.
Thank you. Okay, ma'am.
Okay.
Thank you.
Pamina, this is for you, and for anybody who's asking a question, at least keep your video on.
Oh, so sorry. Okay.
Yeah.
It's me.
Yeah.
You'll put your address on the WhatsApp group, please. Contact.
Eating food.
Eating food is, he knows. I eat food.
Okay. Thank you, doctor.
Yeah, thank you so much.
You come to the Joyce. You have any question?
No, I don't have a question just now.
Your answer I will give you.
Okay, fine. Thank you so much. Yes, thank you, Roy.
Yeah, and Dr. John is my brother-in-law.
Oh. Thank you, John. Nice to know you.
Hey, definitely will come to you. And in our family, Dr. Roy was the first homeopath doctor. And he
I know he also prescribes. He's interested a lot in homeopathy.
No, yes, he's got all the solutions to the problems.
He has his own pharmacy also.
Yeah, he used to prescribe. Yes, he used to tell us, see, look here, this problem, I'll sort it out.
Yeah. होम्योपैथी में साइड इफेक्ट तो है नहीं, डरना तो कुछ है ही नहीं.
Absolutely correct.
And it is his passion, na. So it's his passion to help also. Plus, homeopathy is also his passion. तभी तो मैं यहाँ पे हूँ.
And
Dr. Kalpana, one thing I keep telling my doctors also, who I keep saying that we need to really lobby and go back against these allopathy guys who keep lobbying against homeopathy. I've always
no. See, I clearly stated in my presentation also, building on the silos. You should never try to, एक दूसरे का गला नहीं काटना है. You should always try to collaborate.
A little more awareness about homeopathy is lacking in India, at least, I feel. And I'm happy that we've recorded this. I'm sure a lot of people will see this video.
Yeah, sure. Even I'm planning to edit it and put it on my channel also.
Do you take any courses for people, lay people?
That is what I was going to tell her, because I met her first time. I did one she did a spot test, some 5 or 10 questions.
Yeah.
All your students, and she does a course.
So I have just taken a webinar from Get Courses, and they are planning to launch me with the courses. And my notes are not yet complete, and actually now that everybody is asking for consultation also, I knew that it's going to come up. Let me just tell you that last year we opened a pharmacy at Vakola, Santa Cruz East, And this year now, again, we are shifting to an ownership premises. So in this process, no, I am little bit delaying in all other activities what I want to do in life. But definitely, I don't want to take all the homeopathy upar leke nahi jana hai. I want to give everything whatever I have over here.
No, Roy is neck deep in so many things.
No, I'm saying Roy will give you enough land to, if you want to open anything in Kodam.
Yeah, now that he has given me this opportunity, I am going to be behind him. Because he has a passion to help. And now that he has given me this big help, definitely he has to help me out. Now, pura haath pakad ke chalna hai piche tak. Hai na, Roy?
If there are no more questions,
yeah, then everybody can go home and have lunch.
Yeah, you can go. Then, Johan, you can see, Doctor, it is traditional that we propose a vote of thanks and then we do a group photograph. So, Johan, can you propose a vote of thanks?
Absolutely, my pleasure. In fact,
wait, I'll record that.
And can I ask everyone to put their videos on?
You can take a good photograph and send me a
photograph. Violet, let me see you 3 hours before, man. Otherwise, Violet is my game partner.
Okay. I thought I should not say, but dogs are also named Violet.
So she was purple earlier, now she's Violet.
Oh.
Anyway,
yes.
Firstly, thanks to Roy to facilitate this. It was a very interesting one, a session which is very important in today's times because everybody wants to know which is the most safest way to heal sicknesses and illnesses. And a very, very big thanks to Dr. Kalpana. And I think what we liked about this session is the transparency, the humility, which was very important. And most importantly, since I've been using homeopathy for a long time, you know, the candidness and the transparency, because most of the doctors sometimes don't even tell you what medicines they are putting in the bottles, right? And you have to have faith. But here, I think I've seen Dr. Kalpana, you know, spelling out the names, the composition, and I think that transparency will go a long way in building more confidence in patients. And that is very important, especially in homeopathy. So a big thank you, Dr. Kalpana. I'm sure you're going to get a lot of calls after this session and look forward for more interactions with you.
Thank you so much, Johan. That was really appreciable. Thank you, Reynolds Roy.
Thank you
for giving me such a platform.
Thank
you, everybody, for having the patience to listen to me. Thank you so much. And have a great Sunday ahead.
Doctor, I met Johan the first time because my son and he worked together in some company. I don't know which one, in Bandra, I think. Johan?
Yeah, Planman it was.
So he is like my son's age, huh? Or I'm his father's age, whatever we look at.
Thank you so much.
Thank you, Johan. Thank you, everybody.
Thank you, everybody. Take care.
Yeah.
Good day. Good day to all.
Good day, good day. And Maria? Maria Rodriguez.
Where is Maria?
She's no. You put your no. I wanted to tell her something else. You unmute yourself.
Okay.
So Reynolds, there's Rajesh on. He's my husband. He's also.
Is he?
Yeah. Next to Maria only.
Next to Maria on your screen.
On my screen.
On my screen, he's sitting with another lady, I think.
Yes.
There's Rajesh. Okay. Hi, Rajesh.
Yeah. How are you?
So,
I'm good.
He has been my guinea pig all these years.
Okay.
I got homeopathy through him.
See, all it is showing in that yellow office.
He's been very supportive all these years.
Yeah.
And I'm a regular patient, doctor.
Regular patient.
He keeps medicines in his bag, and if any of his staff has nausea, diarrhea, anything problem, fever hai, fatak se nikal ke dega and go home. And next day that person is okay. Like Roy.
Thank
Roy
you.
is also helping a lot of people. Why is he second?
Thank you so much, doctor. I think we'll end the session now.
Yeah. Okay. Bye-bye, everybody.
Bye-bye.
Bye, Elizabeth. Bye.
everybody.
Bye,
Thank you.
Roy.
Hi,
Thank
Darren.
you. Bye, Roy. Thanks.
Hi, Joyce.
Bye.
Bye. Bye, Femina. Wilma, you should have put your video on. You didn't put your video on. Peggy didn't put her video on. Femina has to be told.
Bye, Roy.
What why, Roy? What to why? every time you have to be told to put your video on.
Hi, Joyce.
When we are feeling a bit low, we can see your face and we feel happy, no? Only Elizabeth keeps her video on. Not forgetting Sheila and Joyce. Joyce, how is the COVID in Kerala now? Joyce, you're on mute. We can't hear you.
Yes.
Not as bad as Bombay.
It's either or on your phone. Either we see you or we don't. What is it?